So the question is this, that what is the difference between hepatitis B co-infection and superinfection? And which one is more dangerous? Hepatitis D co-infection is more dangerous, or hepatitis D superinfection is more dangerous? Now, we all know that hepatitis D is a defective virus. For defective, you can also think in that sense. And they are entirely dependent on hepatitis B, particularly hepatitis B surface antigen, for entering into another host. Now, this hepatitis D infection can occur in two contexts. A person who has never been infected to hepatitis B, they get infected hepatitis B and hepatitis D together. So a person who has never been infected with hepatitis B but susceptible to hepatitis B, he gets infected not only with hepatitis B but also with hepatitis D. This is called co-infection. Another scenario could occur that a person who has been chronically infected with hepatitis B, is a chronic hepatitis B infection is having, that person gets infected with hepatitis D. So the person who was previously infected with hepatitis B now gets also add-on infected with hepatitis D. This is called hepatitis D superinfection. Now the difference is that which one is more dangerous. Now I'm going to answer that question. Answer is hepatitis D superinfection is more dangerous. Why? I will explain. Hepatitis B co-infection means that both acute hepatitis B and acute hepatitis D is happening together. This is called co-infection. And co-infection, what happens actually, that most of the cases they resolve automatically. That means they get cleared of both acute hepatitis B and acute hepatitis D, these infections. But what is the difference between just having acute hepatitis B versus co-infection of acute hepatitis B and acute hepatitis D? That co-infection could be more severe form of acute hepatitis or acute liver failure that can develop when there is a co-infection. But most of the cases they give the patients recover. So co-infection can cause severe form of acute liver failure, acute hepatitis, but they usually get cured automatically. Most of the cases, the patients resolve actually, the patients recover. Compared to that, this other form is called superinfection. Superinfection means you are having, I already mentioned, you are having chronic hepatitis B, now we get superinfected, add-on infected with hepatitis D. These cases, it has been seen, is more dangerous because more than 80% cases, these cases, the patient now not only have chronic hepatitis B, but they also develop chronic hepatitis D infection. So in superinfection cases, chronic hepatitis D infection persists for long, and it usually becomes chronic hepatitis D superinfection. And in such superinfection cases, it happens really more than 80% of cases. And such superinfection cases, another thing happens, that there is an increased chance of development of cirrhosis and hepatocellular carcinoma, which is the primary liver cancer. So overall, altogether, what I told is that if you develop hepatitis D co-infection, then there is a higher chance of developing severe form of acute hepatitis, but they are not so dangerous in the sense, because most of the cases they would be resolved. The person would get cleared of both hepatitis B as well as hepatitis D. So as hepatitis B is also getting cleared, you don't have chance of persistence of hepatitis D, because hepatitis D needs hepatitis B. That is the first story for co-infection. But superinfection is more dangerous because a person already has established hepatitis B. He has chronic hepatitis B, and now you are getting add-on superinfected with hepatitis D. In such cases, the problem is more because your supporter, which is hepatitis B for hepatitis D, is already established in the environment. Now he would definitely give add-on support to hepatitis D for persistence. And hepatitis D would basically become chronic hepatitis D. And this coexistence of chronic hepatitis B and D, the patient usually, there is a higher probability to develop liver cirrhosis and hepatocellular carcinoma. So that is the all basic, that what is meant by hepatitis B, hepatitis D co-infection and superinfection, and which one is more serious. That is, obviously, as I mentioned, hepatitis D superinfection is more dangerous from the outcome. Thank you so much.